Hello, welcome back to Don't Spill the Milk with Cindy and Lynette. So, for this episode, we're going to be talking about that second night, which is something that Cindy and I really love to tell our clients about. Cindy, can you tell us a bit about what the second night is?
Absolutely. The second night is the biggest surprise to a lot of parents. And I really feel like when they know what to expect the second night, it can make things a lot smoother in their transition into parenthood. So, a few things happen on the second night. The biggest thing being that baby often wants to cluster feed that second night. Cluster feeding is it looks like baby wanting to be on the breast almost constantly. I'm going to show you with my doll what cluster feeding looks like. Here's my baby. She's asleep, but she's hungry. So cluster feeding often looks like, okay, we're working on getting this latch just right, and it might take normally 5 or 10 or 15 minutes sometimes to get the baby latched on. And the baby nurses and nurses and nurses, and you think, I am starting to get the hang of this thing. This is amazing. The baby falls asleep. He's not drinking anymore. Then we burp the baby. Maybe we hand the baby over to the other parent, or the baby goes in the bassinet for a few minutes. And we have a snack, and then the baby's crying, and you think, oh goodness, you're still hungry. I'll feed you on the other side for a little while. So you nurse the baby. Maybe they latch a little bit better this time because they're getting a lot more practice, and so are you. You nurse the baby, and then you put the baby down because they're sound asleep. This is usually sometime in the middle of the night, like 1 in the morning. You're tired because you had a baby yesterday. You get up to go to the bathroom because you forget to take care of yourself. Baby starts crying. You hurry back from the bathroom. You pick the baby up. You nurse them. Now, this can go on for 2 or 3 or 4 hours in the middle of the night. It can be really challenging for new parents, can't it? And I think if we don't know that that is normal, then we think, oh my goodness, I don't have enough milk. I'm not feeding the baby enough. Why is the baby still hungry?
And many parents think that their baby's starving.
Yes, exactly. But the coolest part of it is, and I love telling parents about this, the coolest part of it is, it's actually your really, really, really smart baby telling your body to ramp up the milk production. It's so cool. So it's the exact opposite of not having enough milk. It's your baby saying, I'm going to help you get more milk from me.
That's right. And that's why it's so important to follow your baby's cues and continue to feed your baby on both sides, going back and forth as your baby asks, so that we can get that milk supply building.
Yeah. And one of the things to keep your mind on, because it can be exhausting and it can be a little frustrating. I always tell parents, keep your eye on the prize, because at the end of that cluster feeding period, very frequently, babies will have a little bit of a longer stretch of sleep, and hopefully the parents can too. And of course, when I say a little bit of a longer stretch of sleep, when we're talking about a 2-day-old, it's 3.5 hours maybe, if you're really lucky, right? Yeah. So you're not getting 8 hours at the end of that, but it's still a good prize.
So you're talking about baby building milk supply. So what does it look like because when baby's first born, there's colostrum. Can you talk about the transition that we see?
Absolutely, yeah. That first few drops that they get at each feeding in the first 24 hours, if we get the baby to the breast fairly often in that first 24 hours, anytime the baby is awake and cueing, then by the second 24 hours, we're already making a little bit more colostrum. And then again, on day 3, we're making just that little bit more colostrum for the baby. So as the baby's ability to suck and swallow and breathe they become much more competent over 3 days of that practice. Then when our full milk transitions, then the baby's able to keep up with it. And that usually happens around day 3 or so.
So after that second night that
after the second night, absolutely. It's pretty cool. Yeah. What about how do you even know if your baby's getting any milk?
Yeah, that's a really important thing that I think that every parent needs to know.
Hmm.
And so we want to be listening for swallows. A swallow can sound like k, k sound. Um, I am hard of hearing myself, so I can't actually hear those swallows very well. So
Hmm.
I look for visuals. And so I look for movement of the ear
Yeah.
and the jaw really making a wider, we'll see little suckle, 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 swallow,
Yeah.
suckle, suckle, swallow. And the more milk they're getting, the less suckles we see. Suckle, suckle, swallow, swallow, suckle, swallow. So it transitions that way.
Yeah, and it's time on the breast doesn't necessarily mean time getting milk, does it? So
Mhm.
as IBCLCs, we teach parents to look closely for those signs that their baby is transferring milk and how efficiently they're transferring it as well.
Yeah,
Yeah,
yeah.
awesome. Well, join us for our next episode when we talk about some of the upcoming weeks and different things that you might notice with your babies then.
We'll see
Bye.
you there.